Welcome back to our channel. Today we're diving into a topic that's both fascinating and important: schizophrenia. It's a complex mental health condition that affects millions of people around the world, and there are a lot of misconceptions surrounding it. In this video, we're going to debunk some myths and uncover the truth about schizophrenia with 10 mind-blowing facts. We'll explore its prevalence, symptoms, causes, and available treatments. Understanding schizophrenia is crucial for reducing stigma and supporting those who live with it. So whether you're familiar with schizophrenia or just curious to learn more, stick around, because these facts might surprise you. Let's get started. Schizophrenia affects about 1% of the population worldwide. That might sound like a small number, but it translates to millions of people globally. To put it into perspective, imagine a packed football stadium. Statistically, there would be hundreds of individuals in that crowd living with schizophrenia. It's important to remember that these are real people, not just statistics. They are our friends, family members, colleagues, and neighbors, and each person experiences schizophrenia differently, making it even more crucial to understand the diversity within this diagnosis. Remember, mental health is just as important as physical health. Just like we wouldn't hesitate to support someone with a physical ailment, we should extend the same compassion and understanding to those facing mental health challenges. Symptoms of schizophrenia usually start between ages 16 and 30. This is a critical period in a person's life, marked by transitions, education, career choices, and forming relationships. The onset of schizophrenia during this vulnerable time can significantly impact a young person's trajectory and require significant adjustments. Imagine being on the cusp of adulthood, excited about the future, and suddenly experiencing these confusing and often frightening symptoms. It's a time when support from family, friends, and healthcare professionals is absolutely essential. Early detection and intervention are key to improving outcomes for individuals with schizophrenia. If you or someone you know experiences persistent and unusual changes in thoughts, behaviors, or emotions, especially during this age range, it's crucial to seek professional help. Schizophrenia is often confused with multiple personality disorder, now known as dissociative identity disorder, but they are distinct conditions. This is a common misconception perpetuated by media portrayals and a lack of accurate information. Schizophrenia is characterized by disruptions in thinking, perception, emotions, and behavior. It's not about having multiple personalities, it's about experiencing a fragmentation of reality itself. Dissociative identity disorder, on the other hand, involves the presence of two or more distinct identities or personality states within a single individual. These identities may have their own memories, thoughts, and behaviors. Understanding the difference between these conditions is vital for accurate diagnosis and appropriate treatment. Chapter 4. Genetics can increase the risk of schizophrenia. Genetics play a significant role in the risk of developing schizophrenia. If you have a close family member with schizophrenia, your chances of developing the condition are higher than someone without that family history. However, it's important to remember that genetics is not the whole story. Think of it like this. Having a family history of schizophrenia might make you more susceptible, but it doesn't guarantee you'll develop the condition. It's like a predisposition, like having a higher risk for certain types of cancer. Many genes are involved, and researchers are still working to unravel the complex interplay between genetics and environmental factors. Chapter 5. Environmental factors can also play a role. While genetics are a factor, environmental factors like prenatal exposure to viruses can also increase the risk of schizophrenia. Research suggests that complications during pregnancy or birth, such as maternal infections, fetal oxygen deprivation, or low birth weight, might play a role in increasing the likelihood of developing schizophrenia later in life. Additionally, childhood trauma, severe stress, and substance abuse have been linked to a higher risk of developing the condition. It's important to note that these factors don't cause schizophrenia in isolation, but they can interact with genetic vulnerabilities to potentially trigger its onset. This highlights the complex interplay between nature and nurture in mental health. Chapter 6. Schizophrenia affects more than just thoughts. Schizophrenia can cause hallucinations, delusions, and cognitive issues. Hallucinations are sensory experiences that feel real but aren't, like hearing voices or seeing things others don't. Delusions are strongly held beliefs that are not based on reality, such as believing you have special powers or are being persecuted. Cognitive issues can affect memory, attention, and decision-making. These symptoms can be incredibly distressing and make it challenging to differentiate between what's real and what's not. Imagine trying to navigate daily life while experiencing these disruptions in your senses and thoughts. It's essential to approach these experiences with empathy and understanding. Chapter 7. Treatment can make a world of difference. Treatment for schizophrenia often includes antipsychotic medications and psychotherapy. Antipsychotics help manage symptoms like hallucinations and delusions, while therapy provides coping strategies and support. It's important to remember that treatment is not one size fits all. It's about finding the right combination of medication and therapy that works best for each individual. Support groups and family involvement can also play a crucial role in recovery. Chapter 8. Early intervention is key. Early intervention can significantly improve outcomes for individuals with schizophrenia. The earlier someone receives a diagnosis and begins treatment, the better their chances of managing their symptoms and living a fulfilling life. Early intervention can help prevent the worsening of symptoms and reduce the likelihood of hospitalization. It's crucial to seek professional help as soon as possible if you or someone you know experiences persistent and unusual changes in thoughts, behaviors, or emotions. Chapter 9. Schizophrenia can co-occur with other conditions. People with schizophrenia are more likely to have other mental health conditions such as depression, anxiety, or substance use disorders. This co-occurrence can make diagnosis and treatment more complex, as it requires addressing multiple interconnected challenges. It's like managing multiple health conditions simultaneously. Imagine having to juggle different medications, therapies, and support systems. It highlights the importance of integrated and comprehensive mental health care that addresses the individual's needs holistically. Chapter 10. Let's break the stigma. Stigma and misunderstanding about schizophrenia are still widespread. People with schizophrenia are often stereotyped as dangerous or unpredictable, which is simply not true. This stigma can prevent individuals from seeking help, leading to isolation and worsening symptoms. It's time to challenge these harmful stereotypes and create a more supportive and understanding society for those living with schizophrenia. Education is key to breaking down stigma. By learning about schizophrenia and engaging in open conversations, we can help dispel myths and promote empathy. Remember, mental illness does not define a person. People with schizophrenia deserve compassion, respect, and the opportunity to live full and meaningful lives. Outro: Understanding Schizophrenia. Thanks for watching. If you found this video informative, don't forget to like, share, and subscribe for more content on mental health and wellness. Remember, knowledge is power. By understanding schizophrenia better, we can help reduce stigma and support those affected by this complex condition. Let's create a world where mental health is treated with the same importance as physical health. See you next time.